Hi there, podcast and public radio fans. Heath Drusen here, host and creator of the Extremely American podcast. I'm working on season 3, which is an urgent story about neo-Nazi terrorists and how they helped build a modern white supremacist movement, even from prison. Some of their ideas have even made it to today's White House. It's both a gripping true crime story and a timely warning about threats to our democracy. And this time, my investigative reporting is funded by you. To support the project, please make a tax-deductible contribution at extremelyamerican.org. That's extremelyamerican.org. And thanks.
More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. You know, doctors spend their time treating and advocating for their patients, but who advocates for the doctors and the other medical professionals that make our healthcare systems work? Well, that's where the Idaho Medical Association steps in. The organization has been around for more than 130 years, advocating for doctors in places like the Idaho Legislature and the Department of Health and Welfare. Susie Keller is the first female CEO of the association, and she has been fighting battles for doctors here in Idaho since 2007 through Medicaid expansion, Idaho's abortion ban, and the COVID-19 pandemic. And this year, the Ada County Medical Society recognized Keller with their 2026 Friend of Medicine Award. And when the ACMS asked if we'd like to talk to her about her work, well, of course we said yes. Susie, welcome to the show. It's really nice to have you with us today.
Thank you so much for having me, Gemma.
So, Susie, let's kind of start at the beginning. How did you get to Idaho? I heard it really wasn't on your bingo card.
Yes, that is very true. At the beginning of 2007, I was in my second year of working as the CEO of the Wyoming Medical Society. I had just purchased my first, I did it all by myself home and adopted a puppy. I was in the community where I grew up in Cheyenne, Wyoming, and I thought I was set. And then by the end of 2007, I had moved with the puppy and ended up in Idaho, having accepted the job as the CEO of the Idaho Medical Association. So it was one of those opportunities that fell in my lap as my colleague from Idaho at that time was retiring, and he had reached out to me to say, you should really consider applying for this job. And my first thought was, well, why would I do that? But then obviously the more I looked into it and saw what a wonderful place Idaho is and sharing so many similarities with my home state of Wyoming, it just seemed like such a great fit, and it really has been.
So tell us about the Idaho Medical Association. What does your organization do exactly?
Well, we are the largest organization representing physicians across the state of Idaho. So in all specialties, all practice settings, and all geographic locations. And we really are the voice of medicine, and we advocate for physicians and their patients by interacting with the legislature, as you said, but sometimes the Department of Health and Welfare, the Board of Medicine. So advocacy is probably the biggest thing we do, but we also provide a lot of support to practicing physicians and their clinical practices by offering benefits such as reimbursement, technical assistance, dealing with insurance companies and all the various forms that clinics have to fill out in order to get paid. We also offer other benefits like financial planning, but probably one of our biggest benefits that we're most proud of was founded and developed by our partners at the Ada County Medical Society, and that is our Physician Vitality Program, which is free confidential counseling for physicians who really sometimes deal with a lot of difficult mental health challenges.
Mm-hmm. As the CEO of IMA, you talk to a lot of physicians, Susie. Well, I'm curious about what's on their minds these days, because there has been a lot of impact to our healthcare system in particular, in the last 6 years.
Absolutely. And the thing that I hear from the physicians I'm lucky to interact with time after time is they just want to take care of their patients. And there's a lot of things that come into play that sometimes get in the way of that patient-physician relationship. And they just want to take care of their patients. So whether it's administrative hassles from insurance companies or regulations from the state or laws that criminalize the practice of medicine, those are some of the things I think that are frustrating them, as well as the increased financial crunch that makes it difficult sometimes for certain practices, especially primary care practices and lately pediatrics, to even have a financially viable practice to be able to sustain. And then I think a lot of folks are also feeling pressure with the amount of disinformation that's out there on social media and patients coming in with information from the internet that they have self-diagnosed and how to partner with patients and empower them with the clinical information and the evidence-based care that's best for them. So a variety of things. I would say they're facing pressures from a lot of different forces, but I also hear from them that they just find such joy in being able to do what they were trained to do, which is take care of patients and their families.
So I know you spend quite a bit of time, Susie, at the legislature when it's in session,
Mm-hmm.
talking with legislators to support these concerns of our physicians here in the state. You mentioned one of the main priorities is when things like medical care is illegal. I'm curious to
Mm-hmm.
know if one of those is Idaho's current abortion ban and your work with trying to support doctors through this ban. And what does that look like?
It's been very difficult in the years since Idaho's total abortion ban went into effect. And I think the thing that's important for people to understand is while I think that the Idaho legislature and our state leaders have made it clear that they want to make it illegal for somebody to get an elective abortion. That's somebody who is pregnant and no longer wants to be pregnant. But what the ban is, it is so wide reaching, it actually disproportionately impacts people and families, women with wanted pregnancies who end up having a really difficult situation, a pregnancy complication that threatens their life, that threatens their future fertility or their health, say lifelong kidney damage or those sorts of things. And obviously, the law has a meager provision for rape and incest, but it requires a police report. And I think we can all understand that that's a really, really high hurdle for some victims of those crimes. So it's been very, very difficult to navigate that. And I think one of the biggest hurdles is, as we have been advocating for changes to the abortion ban, to say that, look, we are setting elective abortion aside. We have heard loud and clear what the legislature wants to say, but what we are trying to do is create some space into the law to care for patients who are impacted by pregnancy complications. And how can we allow patients to get that care here in Idaho, which they used to be able to get before 2022, that they no longer can get. And it's been really challenging just because there is so much emotion and political dynamics wrapped around in it. And even though I think many legislators are sympathetic to our arguments, the political dynamics have just been very difficult to overcome.
And with that, Susie, we've also seen many doctors leave the state. So we also
Yep.
see that the changes, right, in the demographics of our doctors are changing as well. So what, specialties is the IMA working to recruit? Because we have, needs within our communities when it comes to healthcare.
Absolutely. And you nailed it. The impacts of these bans are that many physicians have determined they can't practice here because the law doesn't offer clarity for when they can deliver evidence-based care for these situations. So what we know from a JAMA study that was released a couple of years ago, that between for the years of 2023 and 2024, we lost a third of our OBGYNs who left practice in the state for a variety of reasons, but most of them could attribute it to the abortion ban. And that study didn't even count family physicians who also provide quite a bit of obstetrical care throughout Idaho. And that has a real impact on Idaho's population, half our population. And even if somebody doesn't need obstetrical care, a woman might need specialized gynecological care. And there's been a real bottleneck, even here in Boise, with folks needing that kind of specialized care that have challenges to be able to get it. Also, we've heard about labor and delivery units closing down around the state. So that is something where our state is growing and we're trying to, focus on economic development, and Idaho is a great place to live. But I also think it's really unfortunate that our state doesn't have a robust system of obstetrical care across the state. So that's something we have really tried to focus on. And while IMA has very much focused on most recently urging the state to put more resources into growing our physician training pipeline, that's not going to cut it. We need to also be able to recruit folks into the state. And how do we make our state more attractive when OBGYNs are being sought all over the country? So Idaho hasn't put itself in the best position compared to other states when we're trying to recruit those individuals.
I have about 2 minutes left with you. And, you have done so much in your time at the AMI. One of the things you did was leading the AMI through the COVID pandemic. And you talk about burnout with physicians. I mean, we are still feeling the impact of that, right? And then you put these particular laws in place, and that adds extra stress. With all of that said, what are you most proud of? And where do you see the IMA headed? And something, positive, because we can so often focus on so much of the negative, but there's got to be good points even as we muddle through all of this.
Absolutely. And obviously, COVID was a very, very difficult time for our country, for Idahoans, for patients, for physicians. And looking back at my time at the IMA, there are many things I'm very, very proud of. The advocacy for these different issues, whether it be Medicaid expansion, fighting for amendments to the abortion ban, and fighting for the best care for patients through COVID. But I think one of the things I'm most proud of is that I have really insisted that IMA remain an open table and a big tent for physicians and others with different viewpoints to come together and help us create policies that best serve our physician workforce and their patients. And sometimes you just have to get comfortable with knowing that there's not a perfect answer and being in the tension of these moments. And I think the thing I'm most proud of is that physicians in our organization feel heard and they feel supported, and they know they have an organization that will always have their back.
Well, I want to thank you so much for taking time to talk with us. We've been speaking with Susie Keller, the CEO of the Idaho Medical Association. The Ada County Medical Society recently recognized her with their 2026 Friend of Medicine Award. And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. If this podcast has become a part of your routine, can you tap 5 stars and leave us a review? It helps us stand out.
Each story you hear on Planet Money starts with a question. What happens if we refund tariffs? Why are groceries so expensive? At NPR, we stand for your right to be curious because the forces shaping our world can be hard to see. Follow NPR's Planet Money wherever you get your podcasts and start seeing how the economy really works.